Hello. So, the first recording I would like to start with has to do with questions that I've got, and they are the most common for people who have spinal problems or problems relating to spinal issues. So, it can be pain, it can be weakness, it can be numbness, funny sensations, things like that. Now, one disclaimer that I need to make is this. If you do not have a diagnosis, if you do not know what is wrong with you, you do need to contact your GP and you need to contact your physiotherapist, whomever it is that you can contact at these times. Your GP should be able to address any question over the phone, and they should be able to tell you whether you need to go to there's still services there available for people that they might have a problem detrimental to their health. And please liaise accordingly and appropriately. If you are not certain whether it is a new problem or one of your flare-ups, you can for yourself examine, have I had this before? Yes, no. If it is different, how is it different? That will give you some information. But equally, I don't want to reassure somebody that you don't need to be contacting your GP when anyone can be watching this video. I don't know you, I haven't examined you, I don't know your history. So it is dangerous for me to say to someone, don't reach out to the person who does know you and have seen you. The internet can be a scary place, so when you check for information, please make certain that it is a reliable source, such as NHS-Net, Chartered Physiotherapy Association for pain problems, but even other problems. I would really like to encourage you to the links and resources the Pain Physiotherapy Association has at this time, and as part of the Chartered Physiotherapy Society. You can always Google your pain or problem, something like low back pain, and then red flags, and see if you meet that presentation, but don't self-diagnose. Because a lot of things as lay people, we read in a different way to how a clinician would understand them. And also remember, red flags doesn't mean panic. What it means is now we need to really look into this, because there is even small, but a chance that this might be something dangerous. And if it is dangerous, of course, we don't want to take any chances. We want to be safe rather than sorry. So having said all that, and please ask questions and I will try and address them if I can in the comment section. Let's touch about certain words that we might know or heard, whether from an MRI scan or something a clinician has said, and what that might mean. So I will start first with things that we might see in an MRI scan. So one word that you might have heard quite a bit is degeneration. Now, if you have really uncomfortable symptoms, like a lot of pain, or numbness, or something else traumatic, and to hear that you have degeneration in your spine, and sometimes it can be said in a very, very dramatic way, like, oh, there's a lot of degeneration throughout your spine, or there's early degeneration, or your spine is more degenerated than we would expect for your age. Or it might be something like, you have degeneration all the way from, S1 to S5 or L4 to S1, all those type of things. It sounds quite scary. But let's first examine what degeneration is. Degeneration for other tissues that we are more familiar with because we see them and we can, we can evaluate them in everyday life-to-life situations. There are things like degeneration of our skin. Degeneration of our skin is very simply things like wrinkles, discoloration, and all those things are usually quite innocent. It's just that, our body ages. That is all that it means. And it ages outside, but also it ages inside. And that is unique to us, in the same way that some people might get like one wrinkle when they're 90, and other people have a lot of wrinkles by the end of their 20s. But let's say the person with one wrinkle might have gone gray in their 20s, or the person who had a lot of wrinkles might never go gray or get one gray hair. In the same way, we all degenerate in comparison to ourselves, not with other people. It's unique to us, and it doesn't mean because one tissue degenerates faster than another, that means something overall about us. Our bodies are designed to take that degeneration, and they can cope and compensate for it. Same is true with our spine. So when we're talking about spinal degeneration, that is normal to our spine. The thing though is, around our spine there are a lot of tissues with a lot of nerves and nerve endings that can give a lot of sensations. So if the degeneration is such that it irritates any of the surrounding tissues, can cause a lot of pain. Also, certain types of degenerations can also be in a location that might cause extra pressure or something similar to bypassing tissue like a nerve. And again, it can cause a lot of pain and a lot of symptoms, and those will feel quite sinister, but they're not actually dangerous, and there is a lot of research to say that. So I'm not trivializing here the problems you might be experiencing at all, and you still need help, and you need to think what you're doing about them, and mainly what you can do to help yourself, because ultimately it's about keeping ourselves healthy. But it is to say that there is a difference between serious. Serious to me means something that causing us a lot of problems in our day-to-day life, but to dangerous. Dangerous is something that might cause, our death, in the worst case scenario, or things like serious disabilities, like losing use of our legs, for example. So that is the discrimination that I will be making. So it's not to say that if you have degenerative problems that cannot be serious to you, but at least you can be reassured that it's not dangerous and it is normal to your body. On the same page, I will want to say that arthritis of our spine, and many times the two terms are used interchangeably, arthritis and degeneration. Same with wear and tear. And clinicians, we hate the expression wear and tear because it makes people think that, therefore, if I use my tissues, like if I move, that will be worse for me. And because when we are already in pain, when we move, pain does increase. If we have this concept that I'm actually also damaging myself because I'm wearing things out, then we might stop moving, and that for sure will damage our body. So we need to keep on moving throughout all circumstances because our body is made for it. And this is how actually it can bypass problems. If you don't move, you're stuck with a problem. You are not offering any opportunity to your body to find out, can I bypass that? Now, I'm not saying ignore the pain and just push through it, and any advice you can find on pain, it never advises that. It just means that, step by step, gradually, as you feel your confidence building, and by doing things, see how you can gradually increase and build on your movement, because basically that is what you need. And this is why I don't like terms like wear and tear. Arthritis comes from the Greek word arthrosis, which means joint. Itis basically implies that there's some degree of inflammation. Basically, it means any joint problem that doesn't fall into a distinct pathological category, like osteoarthritis, that is an actual pathological condition of the tissues, even though quite common. Uh, and this is why it is used usually interchangeably with degenerative arthritis is another thing you might hear. Basically, they all describe the fact that our spine ages, and there is no right or bad time for it. So if you have somebody telling you, oh, your spine is so degenerated more than we would expect for your age, it's like saying to someone the same thing that went gray in their 30s. Like, yeah, it happens. We're not all designed in the same way. There are things like genetic predisposition, lifestyle, so many factors. It doesn't mean that there is something inherently bad with it. Now, the other terms that you might hear, again, are scary, and they're used interchangeably, but they all mean the exact same thing, is disc prolapse, disc bulge, and slip disc. Slip disc is my all-time favorite, and I'm being very sarcastic here, because slip disc implies that there is a disc that slipped, moved away. That is not actually what happens. So if we think, and I'll try and make a design of our spine, it's like it's saying our spine, and this is why our spine can take a lot of damage and still be healthy. Even if we have pain, even if it causes symptoms, it doesn't mean it is unhealthy. It can still be healthy, and it's built in a very genius way to be able to do that. So what we have basically is our vertebrae, so wrong side, stacked the one over the other. In between those, like suspenders, if you like, we have the disc. This is not a good design, as you can see. And I made the disc far bigger than they are, because usually they are lined with vertebrae. And what happens is those discs, are not made to last for our whole lives. In all probability, for most people, not all our discs will be intact until the end of our lives. We will have what is called dehydration, which means that they lose a lot of their water. And dehydration can also lead to things like part of the disc being ruptured. Now, our discs are like a disc, basically. And the outside is like collagen, but the inside is like the meat of a crab or jello. So if the outside gets ruptured, and that can happen for genetic reasons, mechanical, lifestyle, things like smoking is not your friend, unfortunately, not even in this way, they can cause gradually the rupture of the outside of the disc. But because the inside is like jello, it starts pushing out. Now, you will have a lot of disc prolapse, and if you don't have an MRI scan, you will not even know. Nor do you need to know, because it happens. It's a type of injury that our body is prepared for. But depending on where the disc prolapse happens, you might have things like the nerve root coming by just next to it, and that is where you can experience a lot of problems. The first problem you can experience is that there is a release of a lot of chemicals, because it is like an internal injury at the time, and the release of those chemicals and in the surrounding area are very, very irritating actually to our body. The other thing is that it can also mechanically press on the nerves, or even worse, in the spinal cord. And how can you know that? This is how I said, and I'll come in a bit back to it when we actually need surgery, as opposed to it's an option. So if it presses on something mechanically, that can also cause symptoms. But initially, you will experience a lot of pain. I have been through it myself. I know it's a lot of pain. And that pain is at its worst for a month. After a month, you should be able to start noticing improvements. I'm not saying be pain-free, but it's not like, to any degree of imagination, unbearable pain. It's just about bearable. And when I say just about bearable, I'm not meaning like moderate. I mean 10 out of 10. It's just before it's above 10, with 10 being the worst pain you can imagine. And within 6 months to a year, usually it will settle, especially if you use your body in normal ways and function normally to teach your body it's safe for you to move again, find alternative ways of moving. Now, some of you might have already experienced that this didn't work for you, and there is a variety of reasons, and there might be a follow-up video about how pain can persist and carry on even though healing might have occurred. But it is something that happens in our body in the same way like allergies or asthma happens. Different functions in our body, and pain is a function, can move into a place that they just carry on, or they're being overreactive. And if you think of how strong the stimuli is initially for pain, when you have a disc prolapse that has been painful, like really irritating the nerve, even if it really, really heals, because the trigger was so strong, you might get in a place that, you carry on experiencing really serious problems. Also, when we say heals, it's unlikely that the disc prolapse will heal in a way that you no longer have a disc prolapse, even though sometimes we can see improvements. How we mean it is, imagine that somebody burned their arm and burned it very badly, and it heals, which means that they have nothing to fear when it comes to their skin. But it's no longer skin, it's going to be a scar, perhaps a terrible scar. And perhaps that scar even gives us symptoms, saying if it was over the elbow. Perhaps they won't be able to really fully open their elbow. Or, people after surgeries in their breast that can have really serious problems with mobilizing their shoulders. So location and the mechanical elements play a role. And when a disc heals, it doesn't mean that it goes back to how it used to be. It just means that it's no longer unstable. You have nothing more to fear. Whatever happened, happened. And I hope that makes some sense. And other words that I find can cause a lot of worry for people can be also words that don't have to do with their MRI scans. They have to do with things like they might have heard in clinic. The one is if surgery was suggested to them. Now, surgery might be suggested to you in two ways. The first way is because they think it might improve a little bit your pain, or at least stop it from becoming worse. If they think, for instance, that it might extend in your leg, like stop the symptoms where they're at. It might not even just be pain related why they think that surgery might be helpful. Many times they might tell you it won't make a difference to your pain, but what it will do is that your leg is now going numb, for example. We don't want the numbness to spread. We want to stop things here. Now, surgery, think having surgery without any anesthesia. Would you want to do that? Most probably not. It is serious injury to our body. Because we are anesthetized and we don't feel it at the time, it doesn't mean it's not a problematic thing. So for surgery to be a solution, it always needs to be better than the alternative. The risk of surgery needs to be better than the alternative, what you're going through. Does that make sense? So this is why many times you might feel, but I'm in so much pain, how can they not offer me surgery? Because if they don't think they have something, a target that can really make a difference, they're exposing you to even more pain and more problems, and it's not advisable. Also, at times that they will tell you it's 50-50 whether it will help. They don't mean it's because many times people translate that, it means 50-50, that, I will be better, or then I'll be left paralyzed and in a wheelchair. No, it means 50-50 whether it will help you or not. If it was a 50% chance of you staying paralyzed, no one would do that. It's too high a risk. So it just means that. But do ask for those questions. The reason why I want to address that is because I know a lot of people that they had been in the waiting list for surgery, and now they cannot have that surgery. And it's scary, especially if they told them you need to have that surgery because, as I said, it can stop your symptoms here. But that is surgery that can help. It's not surgery that you absolutely need. Which are the cases of surgery that you absolutely need? You know how I said that surgery needs to be better than the alternative? There are times that even if there was 50% chance of leaving you paralyzed, we will still go for that if we thought that your chances of staying paralyzed is like 90%. And that has to do with the type of pressure put on your spinal cord, mainly, even more than a nerve. So it has to do more with spinal cord, and you might have heard of things like quadral equina, or worse if we suspect some type of cancer. That is an urgent surgery, and that will still happen even at this time. So if you're in a waiting list, it means that you not having surgery, yes, it's perhaps unhelpful, but there's nothing for you to panic or fear at this time, and I will still encourage you to move. I understand it is quite scary to move when you're in a waiting list for surgery, but go with your comfort zone. You don't have to do like frog leaps or anything like that. Walk, put some light music and dance to it. Imagine you're in a butterfly forest and, natural movement, just collect the butterflies. Do exercises that you might have had from the past by your physiotherapist. Do gentle movement, but keep yourself going, basically. Go up and down stairs. Going up and down stairs might be quite difficult, but it's not dangerous. If you have knee osteoarthritis, obviously if your knee is really swollen and big, still I will encourage you, even though surgeons will say, orthopedic surgeons, don't use the stairs, what they mainly mean is that don't overdo it with the stairs. But if you can use as an exercise just one step, once, twice, after 2 hours again, once, twice, just to keep the movement going, that will be good. You're not looking to irritate, you're looking to keep yourself going. The other thing that people can hear, and it can be quite scary, is that they might end up on a wheelchair. Now, I don't like to contradict other clinicians because that is confusing to people, and why should you listen to me? Especially because I'm not your physiotherapist, I'm not involved in your care, and not the person who said that to you. I will say this, I don't know what the circumstances of that might be, but except if you have red flags like quadral equina, you were with an orthopedic surgeon or a neurosurgeon, and they told you need to have urgent surgery. If you don't have it, we're risking you being paralyzed. Any other context is not advised that the person cannot. And unfortunately, all of us, with very good reasons, might say something like that at times, even though we shouldn't. But mainly it can be if we see that we want somebody to double check something. For instance, you might be seeing an osteopath and they might trying to explain to you that, yeah, we know that our approach has been helpful for you in the past and you might still want this, but we advise against it because we suspect you have a disc prolapse that we might be making worse. And you might still be like, yeah, but it's what helps me, and so on. And they might tell you, you don't understand. If I carry on, you might end up paralyzed. And in their context and how they said it, they said the right thing. What we might not think, though, at the time is that for the person who has the pain and hears that, they might internalize that as being told that actually things might happen, not osteopathic treatment only, any type of such movement that can launch you to be paralyzed, or end up in a wheelchair. That is not a prediction outside what I said about quadral equina, and that is after investigations. You have, the MRI scan, somebody pointing out what is happening and telling you that if we don't put you for surgery within the next 24 hours, you're in deep trouble. If that's not the context, any other context, nobody can make such a prediction. And even with things like degenerative arthritis, that we say is degenerative, that cannot predict what will happen to you in terms of your symptoms. Because degeneration, what is the speed of degeneration? It might be really, really slow. Overall, so as we discussed, degeneration is normal to our body, and if it doesn't encroach on something that causes symptoms, it's not really a problem. So you can see, and therefore you can see many times people's spines in MRI scans that look like the whole spine has been fused by them, and the person hardly has any symptoms or problems because their body compensated. They're fine, they're still healthy. And another thing that I will touch on the video about what ongoing pain is, and you can see in resources about ongoing and persistent pain, or long-term pain if you like, chronic pain, describe the same thing, is that pain does not correlate with damage. We can have little damage and a lot of pain, think of a paper cut, and we can have severe damage and no pain whatsoever. What would make a good example of that? Well, you might know of a person who has arthritis on both their knees, and they say that actually the knee that has hardly any arthritis is a really painful one, whereas the person that, the side that has the bigger problem, the side with the bigger problem, hardly gives any pain, and the side with the less arthritis gives more pain. And there can be a variety of reasons behind that, but pain does not correlate. So even though arthritis can be degenerative, pain is not. So no one can predict what will happen to you. We can just advise on the things that will be helpful for your health and maintaining yourself in the best possible way, but you cannot predict what will happen to a person. It's impossible. So even, I'm sorry, I know I will use the word so it can be turned into a drinking game, but if you have been told that in a session, I'm not going to contradict the clinician. I will say most probably they said it for a good reason at the time, but bear in mind that they didn't actually predict that you will stay in a wheelchair. There's just one setting that can happen, and I've explained that. And the other thing that perhaps is last but not least is about medication. Medication, when it comes to pain and arthritic problems, is not healing type of medication. It doesn't restore anything. It's just symptom control. And if you can live with the symptoms, you don't have to take it. I'm really highlighting that because especially at this time that we are prescribed medication over the phone, we might think that we need to say yes and even raise an objection or ask questions at the time because we might think this is what we need to take. The exception to that is rheumatoid conditions. Now, with rheumatoid conditions, and I'm very careful of that because in many cultures we have this concept of rheumatism, which is just generic musculoskeletal pain. It's different rheumatoid conditions. Rheumatoid conditions is a diagnosis that is made in combination of your clinical presentation, blood investigations, or other things like biopsies and so on, and usually some imaging investigations, whether it is an ultrasound, whether it is MRIs, contrast X-rays, different type of things to diagnose different things. And we mainly mean things like ankylosing spondylitis, rheumatoid arthritis, not osteoarthritis, not arthritis, rheumatoid arthritis, lupus, there's a lupus that I've had, what else can I, Sjogren's. There are various types of inflammatory arthritis, especially linked with Crohn's disease. Those are different types of arthritis that you can have that are more systemic, and for those you might actually be taking medication relating to that condition, slowing out its pace. It might have a different purpose. Obviously, from my video, you cannot always know whether that is medication you should be taking because it's addressing a health problem, or it is medication that you're taking just for pain control to help you mobilize and move around, you're entitled to ask the person who prescribed it. Also, most pharmacies are open, and the pharmacist can help you with questions like that. So you can literally take the medication, or where you are collecting it, you can ask what it is. And then if you feel uncomfortable about taking it, you can call your GP back and say that, listen, this is just for pain, but I'm already in 3 painkillers. I don't know. They might have a very good reason why they prescribed it to you, but you need to be involved in the decision making. Also, the GP pharmacist and the nurse will be able to offer similar advice. I think this is for it now. I hope this is helpful. In an ideal world, I will put timestamps and things like that. Time is not my friend right now. Also, as I said, I wasn't doing videos ever before. This is why this is so bad from any point of view. Technically, I don't have the equipment to shoot it. I didn't even have the time to properly prepare it. So it's a lot of blah, 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 blah. If anyone wants to make timestamps, but I don't even know that anyone will ever be watching this. So, you have to forgive me also for not being very meticulous about something that I might be the only person who sees it. I don't even know. I will say it because, why will they? Who wants to watch themselves? I'll just, upload it and that's the end of it. So, yeah, I'll try to be better, especially if there is any interest in these videos. Okay, bye-bye. Take care. Keep safe.